Imagine every time your phone rings and it's an unknown phone number. You feel dread, anxiety, fear, or a pit in your stomach. You're afraid to answer because your mind can only hear the words that you hear in your worst nightmare. Your daughter didn't make it, or your son, or sister, or brother, maybe even your mother or father. Sadness overcomes your whole being. You have so many questions, but one that continues to haunt your mind: why didn't inpatient rehab work? Research suggests inpatient drug rehab centers have little effect on lifelong sobriety because underlying psychological issues are often ignored and the plan of care, including length of stay, are rarely individualized. Current treatments offered at inpatient rehabs do not have an effect with lifelong sobriety, as cited by Foster 2012. Dr. Garbutt agrees. Addiction is a chronic illness, and like any other chronic illness, it must be managed over time. Treatment modalities may not be appropriate for many addicts because the root cause of addiction is not always identified or treated. Foster 2012 states internal risk factors include persistently negative mood, feeling stressed or depressed, a genetic predisposition to or family history of addiction, and/or coexisting psychiatric problems like attention deficit disorder, depression, and anxiety disorders. Unfortunately, there's still an overwhelming number of people that don't believe addiction is a disease. They believe it's a choice. That's partly true. The first time, and maybe even the second or third time, a person chooses to use. But at some point, the brain takes over, chemicals, neurotransmitters change, and bam, that person now cannot control their body's need for that substance. Because of this, relapse can occur because an addictive disorder is a chronic disorder, and there is no cure. There's always the potential for relapse, according to Foster 2012. So by treating the addict as an individual when in an inpatient rehab setting, this establishes a solid foundation for the lifelong battle against addiction. If you take a look at the graph from the National Institute on Drug Abuse 2012, you will see a comparison of the treatment for hypertension, a chronic disease, and treatment for addiction, a chronic disease. It shows the severity of the conditions before, during, and after treatment. And what you'll see is the need for ongoing treatment is the same for both diseases. According to Hammond 2011, alcoholism is about 60% genetic and biological. That's about the same percentage as asthma or high blood pressure. No one would dream of telling someone with high blood pressure to just relax and take it easy. Why then, with alcohol and drug dependence, would that be a reasonable treatment? National Institute on Drug Abuse 2012 agrees addiction is a complex but treatable disease that affects brain function and behavior. No single treatment is appropriate for everyone. Addressing underlying psychological issues and offering an individualized plan of care are more effective treatment practices. Clark 2007 states, for decades a bounty of studies on how well rehab treatments work have been conducted, and what they've shown is that the most effective treatment is a combination of different treatment types. National Institute on Drug Abuse 1999 published a list of criteria that should be established in order to treat addiction effectively. NIDA Notes 1999 states treatment should be flexible. Medication are an important element of treatment for many patients, especially combined with counseling and other behavioral therapies. And also remaining in treatment for an adequate period of time is critical for treatment effectiveness. The length of inpatient rehab should reflect the needs of the patient, not be based on what insurance companies think is an appropriate length of stay. That's assuming that the addict has insurance. Many people aren't covered and cannot afford the price tag of an inpatient rehab. Perhaps we can make it more affordable, or here's a crazy concept, free for those without insurance. I hope this presentation has brought more awareness regarding research that suggests inpatient drug rehab centers have little effect on lifelong sobriety because underlying psychological issues are often ignored and the plan of care, including length of stay, are rarely individualized. In closing, there's a great need to reform inpatient rehab centers so they are patient-focused. Relapse rates and loss of lives should be enough for society to recognize this need. Changes must be made in order to give the addicts a real chance at living a life of sobriety. Thank you.